I'm sorry I can't be with you to answer your questions, but I know some of the questions that are bound to come up because they came up here when we launched this research. And one of it was about pharmacy capacity. So if you're moving everybody out of the GP surgery, how are the pharmacists going to cope with this? Well, there's a very simple answer to this one. The pharmacists are already seeing all these patients because people are going to the doctor's surgery, collecting their 51 million pieces of paper, and they're taking to the pharmacy to have them dispensed. So from that point of view, it's not extra work for the pharmacist. The government is now going through a reorganisation of the National Health Service, and our research was very timely. So we fed it into the people who are doing that overall research, and more effectively and with quicker results, we fed it into the group of people who are looking at where pharmacy practice is going to go in the future. I know that there's a lot of questions about how we did this work and how we're working with pharmacy, and I thought the best person to answer this would be Sue Sharp, who's my opposite number at the PSNC. So can you explain to this audience what the PSNC does, and is there an Australian equivalent of it?
Yeah, our responsibility is to negotiate on behalf of all the community pharmacies in England with the Department of Health. So we agree both the services that community pharmacies are going to provide and the funding for those services. The equivalent in Australia is the Pharmacy Guild, and Cos, Sklavos and I meet and discuss issues from time to time. So we are very comparable in that respect.
It's quite unusual for an industry audience to hear that we work so closely with a pharmacy body actually commissioning research. So perhaps you can explain from your perspective how you used it with your audiences.
Right, well, we did the work with the PAGB in the autumn of 2007, and in the early part of 2008 the government published a white paper, which is a policy proposals paper. The white paper includes the proposals around minor ailments, but is also a result of some work we've been doing to try to persuade the government to really set out its proposals for a wholesale development in how the community pharmacy is used to meet a raft of patient needs, and to develop the community pharmacy, for example, into a wellness centre, using pharmacy staff as health trainers, and helping us to meet the problems that we have with growing levels of obesity and obesity-related disease, and the problems with an ageing population. So the white paper itself, together with this minor ailments proposal, which is an intrinsic part of it, has really helped us to develop the case for a radical extension of the role of the community pharmacy. The minor ailments scheme allows and indeed encourages people to get treatment and care for this range of conditions from the pharmacy directly under the National Health Service, rather than needing to go off and get a GP appointment, which is quite unnecessary.
Now that's very positive for pharmacists, but the obvious question is going to be, what's the reaction to doctors when everybody tells their patients that they have to go and see the pharmacist instead of coming to them?
This needs to be seen in the context of a big change where general practitioners are being encouraged to take on roles in care that were traditionally provided in the hospital sector. Well, doctors under their contract are paid on a capitation basis, so they're not paid per visit from the patient. So that helps us considerably. And so we're looking at using the pharmacy to really relieve the workload that doctors would otherwise have, and free up their ability to provide other services. In general, we haven't encountered opposition from the doctors. We have a number of other service developments within the white paper which are really developing the role of the community pharmacy as the wellness centre, trying to address the problems we have with growing levels of obesity and all the long-term conditions that pharmacies can help to care for in the future. So the white paper sets out a whole new framework for using the community pharmacy for a much greater range of care and support for patients and communities, and to try to develop their role as a really valuable resource for the National Health Service in the future. We need a major communications programme. If we're going to change the way people meet their care needs, then it is important, and we've recognised in our work with PAGB how important that is. We've put proposals for a £50 million communication programme, and that's about, well, it's over 30 million Australian dollars over a 3-year period to ensure that we do help patients understand how they can get this care much more easily and much more conveniently through the community pharmacy service, and that's going to be very important.
Can you explain how this white paper is going to be implemented? What's the timetable for it? What things are we going to see as a result of it?
Well, the timescale for proposals relating to minor ailments I would expect to be implemented within the next 18 months or so. I think it's going to take us some time to get them fully developed and the provider function really agreed, but I would expect that by the early part of 2010 we'll have this up and running.
A final question, Sue, is what do you think that we got by working together on this?
I think we gained a tremendous amount. We surprised the government. I think we changed government policy. I think we had a tremendous influence that neither of the two organisations would have had if they had worked alone. When we began the discussions, we recognised, didn't we, that we were in fact both working on the same area because we both identified the need. And through the joint working and showing the government that there was a unanimity of interest both from the PAGB and the PSNC, I think we helped to shape quite a fundamental change in the way the government was wanting to approach this issue. So Sheila, do you think there are other opportunities that are going to be coming along in the future for us to continue to work together, possibly on a particular disease area?
I found it a really useful exercise, so I thought working together was very constructive. We came up with better questions, with better research, and when we put our case to government, it wasn't just industry saying it, because there's always the chance that you would say that, wouldn't you? Whereas working together with pharmacy was a really strong case, and I would certainly look for an opportunity to do that again. So thank you very much, Sue, for taking time to do this video with me. And I think this is the point where I hand it back to ASMI. It's your conference. I hope we've given you enough information to get a good discussion going. I'm quite sure Juliet will be able to answer a lot of the questions we couldn't cover in this short video. And thank you for the opportunity of explaining what's going on in the UK.